Welcome to this clinical education video on systemic vascular resistance, powered by the Argos Cardiac Output Monitor. Systemic vascular resistance, SVR, is a critical component of hemodynamic stability. The value of SVR represents how much the systemic vessels resist the flow of blood. The smaller the vessel diameter, the greater the resistance. The highest resistance is therefore found in the arterioles. This equation shows the relationship between pressure, flow, represented by cardiac output, and resistance. In shock, sepsis, or cardiac dysfunction, understanding both flow and resistance helps guide fluid, vasopressor, and inotropic therapy. The normal range of SVR is from 700 to 1500 dynes per second per centimeter to the fifth power. Argos uses femoral or radial arterial waveforms to derive cardiac output continuously. The SVR is calculated with the multi-beat analysis technology, with no external calibration needed. In many clinical situations, such as the administration of a vasopressor, both mean arterial blood pressure and SVR will increase together if the patient responds to the drug. In some instances, however, SVR will change while the blood pressure remains constant. Consider this patient, who was found to be bleeding internally in the ICU after surgery. The blood pressure and other vital signs were all within the normal range, but the SVR was elevated while the cardiac index, or flow, was below normal. The clinician at the bedside used the abnormal resistance and flow readings to help determine that the patient was compensating for the blood loss, or hypovolemia, by squeezing his vessels via a reflex response to maintain his blood pressure. Thus, knowing the SVR can aid the clinician in both diagnosis and treatment of shock. The Argos is trusted by major academic centers. Choose the Argos for reliable, easy-to-use, and affordable advanced hemodynamic monitoring.